Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual, and today we have some more important rules in the clinical care tips category. Rule number 111. Rule out the true emergencies first. As a PEM physician, whatever the chief complaint is, I think it's most important to first rule out the true emergencies that can possibly represent the chief complaint, if possible. So if an 8-month-old comes into the hospital to the pediatric emergency department with a chief complaint of fussiness, and my exam is consistent with that, I immediately think about intussusception and get an ultrasound as quickly as I can. Keeping in mind, obviously, that colic, being fussy from having a viral illness, or even a hair tourniquet, which obviously is important to rule out, don't really put the child at risk. For the most part, everything else can wait. Whatever is bowel or brain or organ threatening should be rectified first. Certainly, if my physical exam indicates something specific, for example, if there's a fracture or concern about trauma, I take care of the obvious things first, get an x-ray, clarify the situation, but I try to keep in mind what will be the emergency condition that will explain this and rule that out first. Intussusception is specifically time-sensitive due to the possibility of bowel ischemia and loss of bowel, not something you want to wait on to diagnose. If you haven't already, I encourage you to listen to episode 43 from July 18th, which talks about my approach to the ill-appearing baby, which stresses the same point. Rule out the true emergencies first that you can hopefully fix before you take care of the rest. So if the child appears ill, altered mental status, etc., check the glucose first because you can fix it before you send them to head CT to make sure there's no bleed, etc. This rule is probably why we and EMS personnel again check glucose very often. Hypoglycemia can explain many symptoms in a pediatric patient such as altered mental status, seizures, possibly fussiness, etc. It's a true emergencies and it's something we can all fix, which is why it is always a good idea to check it first. Rule number 112. This one is actually the rule of 15. I'd like to give my nurse Vivienne, who I used to work with a few years ago in the pediatric emergency department. She actually learned that rule from Dr. Shah, who's a pediatric endocrinologist in the previous hospital where she worked. The rule of 15 is the rule I use to treat hypoglycemia orally. So since we already spoke about hypoglycemia today several times, here is a rule I learned from one of my nurses who learned that from a pediatric endocrinology doctor, how to fix hypoglycemia with oral treatment. So again, hypoglycemia is something that I always worry about, something that I can check very quickly, fix very easily, and you can give the child glucose in two ways. The first way to fix hypoglycemia is using the rule of 50 to 100. So whatever dextrose content you're giving to the child, IV, times the cc per kilo has to be equal to 50 or 100. For example, if you have D5, 10 cc per kilo, 5 times 10 is 50, perfect. If you have D10, you can give 5 or 10 cc per kilo, 10 times 5, 50, 10 times 10 is 100. So anytime you want to fix hypoglycemia through the IV, take the dextrose content, multiply by the ml per kilo that you're going to give, and as long as it's equal 50 to 100, you're good to go. Rule number 112 speaks about how to fix hypoglycemia orally. 15 grams of glucose, which is really 4 ounces of juice, wait for 15 minutes and check the glucose again. If you get a child that has mild hypoglycemia, is alert, interactive, and you think he can take PO, give 4 ounces of juice, wait 15 minutes and check the glucose again. Again, I'm going to give the credit to Dr. Shah, who's a pediatric endocrinologist. There are exceptions to that rule. Remember, if you're trying to fix hypoglycemia orally and the child is having severe diarrhea, there's very likely chance of malabsorption, which means the glucose is not absorbed and likely will not fix the hypoglycemia. In that situation, I prefer to fix the hypoglycemia via the IV route, but then again, you can never lose anything if the child is alert and interactive. 15 grams of glucose, which is 4 ounces of juice, wait 15 minutes and check the glucose again. Rule number 113. Remember, it depends. Know the epidemiology. This rule has to do with giving the most impressive answer when you get asked about almost anything pediatric related, especially if the question starts with, what is the most common cause of? The answer to that is almost always, it depends. It depends on the age. So a few months ago, I walk into the room in the ER and there's an 8-month-old with the chief complaint of vomiting. As I walked in, it was very evident that the child looked dehydrated, not particularly well appearing. I examined him for a very short time and I was fairly certain he has a surgical abdomen. So what is the most common cause of a surgical abdomen in an 8-month-old? Again, we discussed today intussusception. If you know some fairly basic pediatric emergency medicine epidemiology, you know that it's probably intussusception. And guess what? His abdominal ultrasound was positive and he had exactly that. So knowing the epidemiology in pediatrics, in pediatric emergency medicine, is very important. If you see a child with a surgical abdomen, you gotta know what the most common cause of a surgical abdomen is in that age. And check for that first. It's very unlikely an 8-month-old is going to have appendicitis. So if you see a 7, 8, 10-month-old with what looks like a surgical abdomen, check for intussusception. If it's a newborn who's only a few days old, you gotta worry about malrotation with valvulus. I encourage you to listen to episode number 3 of PEM Rules from a long time ago that talks about the rule of 6. The rule of 6 helps us remember the most common cause of a surgical abdomen by age. Again, very important to know the epidemiology. Along the same line, if I see a 7, 8, 9-month-old with blood in the stool who looks very well and has no other symptoms, no fussiness, normal physical exam, I think it's important to know that the most common cause of hematochezia in a child that age is milk protein allergy. So if the child is well appearing, no fussiness, nothing to suggest intussusception, I simply provide reassurance to the parents. Make sure they follow up with the PCP because the kid is going to need some kind of special formula, Nutramigen or one of the other hydrolyzed formulas, and I give you assurance and nothing else. So again, knowing the epidemiology is very important in order to have a narrow differential diagnosis and hopefully to do what's right for the child. It's also a very impressive answer to give on rounds when you asked what is the most common cause of X in pediatrics. Keeping in mind that pediatrics has a very wide range of ages, and what's common in a 17-year-old is very uncommon in a 2-year-old. So remembering the epidemiology can help you develop a narrower differential and hopefully do what's right for a patient. And that is it for today, guys. Thank you very much for listening. Hope you learned something. Hope you like the rules. Let's review what we learned. Rule number 111. Rule out the true emergencies first. Think about your chief complaint. Think about what serious medical or surgical emergency can represent such a chief complaint and rule that out before you think about anything else. Rule number 112, the rule of 15. Try to remember how to fix hypoglycemia orally. Give 15 grams of glucose, which is 4 ounces of juice, wait 15 minutes and check the glucose again. Rule number 113, remember, it depends. Know the epidemiology. Make sure you know some basic epidemiology of a surgical abdomen or some other chief complaint that is based on age. That will help you develop a narrower differential diagnosis and hopefully reach a conclusion or make the diagnosis sooner. So thank you everybody for listening. I hope you like the outro. This is called Kashmir by Led Zeppelin, arguably one of the best rock bands in the history of rock music. And this song specifically is a masterpiece. How Jimmy Page and Robert Plant came out with that tune is beyond me. Love playing that on the guitar. This is the best way I can do it. Hope you like it.